Good evening, everyone. Thanks for joining us. A local nonprofit could have to repay the city of Cincinnati as much as $20,000 in taxpayer funds because of the results of an audit released today.
That's right. City Manager Harry Black ordered the audit 2 months ago after the 9 on Your Side I-Team discovered issues with how the Center for Closing the Health Gap bills the city. Investigative reporter Hillary Lake has combed through this report. Hillary, what else stands out to you?
Well, guys, in the 78-page report, the city shares responsibility with the health gap for the audit's findings. That report also confirms the findings of our I-Team investigation. From healthy corner stores to access to quality health care, the Center for Closing the Health Gap's mission is to serve some of Cincinnati's poorest neighborhoods. A city audit released Thursday uncovers the nonprofit, run by former Mayor Dwight Tillery, was billing the city for questionable expenses.
What this audit tells me is that the health gap is guilty of a lack of internal administrative oversight and quality control as it relates to their invoicing process.
City Manager Harry Black started the audit in March. Mayor John Cranley ordered it after a 9 on Your Side I-Team investigation revealed the health gap had billed the city for work done by the Black Agenda, a political group. It also wasn't operating the number of healthy corner stores required by its contract with the city.
In terms of that particular element of the contract, they were lacking. However, the way that you deal with that is when we redo the contracts.
City auditors went through the health gap's city funding for the past 5 years, totaling nearly $3 million. Some of the other findings include subcontractors the city paid for health gap work might have also simultaneously worked for the health gap, which could be red flags for the IRS, and questions about how many people the group is actually reaching with its block-by-block intervention program. The health gap refused to give auditors more information about that. But Black says auditors also found the city contract, which the health gap wrote but the city approved, is also a problem because it's too vague to enforce in some areas.
The city bears tremendous responsibility in this, and that's outlined in the audit as well. But again, that's still no excuse for not doing complete or accurate work.
Black's office will monitor the health gap's contract instead of the health department for the foreseeable future, and he's recommending the city fully funds the group's request for $750,000 in next year's budget. And the audit also impacts other nonprofits that get city funding. All of them will now face stricter oversight from the city going forward. We also reached out to the health gap today, and we are waiting for a response.